Doctors from the CDC are now here in Washington State monitoring this situation. They say above all, the risk to the general public is quite low and that they've gotten on top of this quite quickly. The patient is currently in isolation at Providence Regional Medical Center in Everett, where he is in satisfactory condition. He was in the hot zone in Wuhan, China just a couple of weeks ago and started showing symptoms when he got home last week. He was immediately suspicious and went to a clinic on Sunday. By Monday, the CDC confirmed he has novel coronavirus. The good news for everybody is that it was caught very early, so he is expected to be okay. Again, listed in satisfactory condition at the hospital right now, while doctors try to track anyone and everyone down who he came into contact with. Meantime, State Secretary of Health John Weisman says there is no need to panic.
At this point, folks should go around and do their normal business. And as he said, if you have a cough or sneezes, cover those. Stay home if you're ill. If you have not yet gotten your flu shot, do that. In part, that's just good health this time of the year. But if somebody should have this infection, it helps us rule out other diseases of concern.
Now, health officials are not saying exactly which local clinic that patient visited, but they say they do know where it is. They've been in touch with those folks and they're monitoring everybody there to make sure they are all healthy, and they hope that this patient up in Everett will be able to go home sometime over the next 48 hours. And health officials stress that while the symptoms of this virus do look a lot like the common cold or the common flu, they say if you start feeling sick, if you have a cough or some respiratory issues or some sneezes, don't immediately start to freak out. They say that unless you've traveled overseas or come into contact with somebody who does have this specific virus, you're probably going to be okay. Send it back to you.
All right, Eric Wilkinson, thank you. So there are a handful of airports worldwide with direct flights from Wuhan, China. Right now, screening is happening at 3 U.S. airports: LAX, San Francisco International, and JFK in New York. 2 more airports are added to that list this week: O'Hare in Chicago and Atlanta. So, as we said, this patient came through SeaTac, but will SeaTac end up on that list? King 5's aviation expert Glenn Farley joins us live from the airport as our coverage continues. Glenn.
So you're right. I mean, you would think that this would become a screening center for this because we have connections to China, but it is not going to. Basically, SeaTac is now the 8th busiest in the country. About 50 million passengers went through here in 2019. But while we have a lot of direct flights to China and Asia, not everyone, including this gentleman, came in that way. He would have been on what they call a code share flight, where they pass customs in another city like Minneapolis and then arrive on what is otherwise a domestic flight to Seattle. At SeaTac today, we found a high degree of awareness of this illness, and I met a man who wasn't traveling to and from China, but is from the city where this all started, Wuhan. Your friends and family saying back home?
Just they are fine. They're taking cautions just like me.
When we got on the airport, on the flight, we are definitely having the masks and we are taking our supplements.
I have, and it's kind of scary. I don't know that they know exactly what the seriousness of it is yet, and that's what makes it a little scary.
Now, I was on a teleconference with some state and county and federal health officials earlier in the day, and they are very concerned about this. So what is likely to happen at the airport? First of all, they need to backtrack his movements here, like you heard Eric explain to you earlier. Also, you can expect to see some sort of indication about symptoms and things to look out for. And they are keeping an eye here on SeaTac as well. Live at SeaTac, Glenn Farley, King 5 News.
Glenn,